the first two or the first three people would be selected. Okay, and क्या फीस वो तो एफएमजी वाले बताएंगे, मैं अपनी तरफ से बता रहा हूँ कि या देयर वुड बी अ प्राइस फ्रॉम माय साइड, बाकी आई एम नॉट श्योर। एक बार ये कर देना यार, गॉट इट कर देना बस। चलो, now let's start with question number 1. It says a 40-year-old woman is brought to the emergency department following a car crash in which she was the driver. In emergency department, her blood pressure is 80 by 60 millimeters of mercury beta. The pulse rate is around 128 beats per minute, and respiratory rate of this patient only 3 breaths per minute. She complains of a right lower chest wall and severe right upper quadrant tenderness. Her breath sounds are diminished definitely. The immediate priority is to perform which of the following? Important is pehle to make a provisional diagnosis. Obviously, if they are saying about some accident beta or a crash, it has to be a case of trauma. In trauma, definitely now we'll see what are the vitals of the patient beta. ठीक है, तो अगर vitals में obviously in trauma definitely the guidelines that we follow, they are according to which protocol? Anybody? Shabash. They are according to the ATLS protocol, that is Advanced Trauma Life Support. What is the sequence that we follow in ATLS protocol? A, B, C or C, A, B beta? It is definitely A, B, C, D and E definitely. Okay? If I talk about A, B, C, D, E, A stands for airway management, B stands for breathing management, C stands for circulation management, D for disability management, shabash, and E for exposure with environmental control. Important is that. Then CAB protocol or CAB sequence is followed for. It is very good. It is followed under the BLS, that is basic life support, or the advanced cardiac life support wala protocol beta. ACLS या BLS के protocol में first priority will be given to circulation and therefore the sequence will be CAB. वहां पे you will immediately start chest compressions in a patient of cardiac arrest. ठीक है, when the patient is unconscious and unresponsive. ठीक है, so that was about the protocol that we follow. So important is यहाँ पे vitals check कर रहे हैं patient के. The BP of the patient is around 80 by 60 millimeters of mercury, more or less. Less definitely. Pulse rate is 128 beats per minute, more or less, more. So definitely अगर अपने पास बेटा we have the BP and the pulse rate, what do we calculate? We calculate the shock index. What is the formula for shock index? Heart rate upon एक तो mean arterial pressure ले सकते हो, or you can take systolic blood pressure बेटा. ठीक है, mean arterial pressure or systolic BP. Mean arterial pressure will be slightly better, but in emergency we don't sit and calculate the mean arterial pressure. That is the reason emergency में we take it as SBP itself. Heart rate कितना दिया इस patient का? 128 beats per minute. And what is the systolic BP? 80 definitely. Now please tell me the shock index will be more than 1 or less than 1 beta? It will be more than 1. Okay, क्योंकि numerator बढ़ा है. And if the shock index is more than 1, definitely that is suggestive of hemodynamically stable or unstable patient. So my patient is hemodynamically unstable. Hemodynamically unstable मतलब my patient is going into shock. क्योंकि जब मेरा patient shock में जाता है बेटा, when there is extreme blood loss from a patient, definitely that causes decrease in the blood pressure, that is hypotension. And to compensate that beta, definitely to increase the BP, what our body tries to do? Our body tries to increase the heart rate, that is reflex tachycardia. So definitely hypotension plus tachycardia is suggestive of a shock in a patient or a hemodynamic instability. Now, chalo, my patient is in shock, that we know there would be a lot of bleeding. But after this, they have said that the respiratory rate of the patient is 3 breaths per minute. What is the normal respiratory rate? 12 to 20 breaths per minute. ठीक है, range can be 12 to 20 breaths per minute. यहाँ पे it is very very less. मतलब is your patient able to breathe बेटा? No, तुम्हारा patient सांस नहीं ले पा रहा. Okay, the patient is having very much difficulty in breathing beta. And apart from that, definitely you can see that the breath sounds which are there beta, they are diminished. The breath sounds are diminished. Okay, दिख रहा है? Breath sounds are diminished definitely. So is the air able to enter inside the lung? No. So respiratory rate is low, breath sounds are diminished beta. ठीक है? Anybody, what do you think can be a provisional diagnosis? Along with that, they are also saying that the patient is having chest wall tenderness. Chest wall tenderness मतलब जब उसकी chest wall को छूते हो, then the patient experiences pain. Okay, pain on palpation or pain on touching is called as tenderness, beta. So all of these are suggestive of what? Definitely the patient had some trauma to the chest or to the abdomen. Abdominal trauma भी है, इसकी वजह से the patient might have a lot of bleeding, and जिसकी वजह से the patient is going into shock. Second important feature is they are saying definitely that the patient's respiratory rate is almost about to crash. 3 breaths per minute है वो. Okay, so the patient is not able to breathe. तो क्या होता है trauma के cases में? We know बेटा, for example, this is the pleural cavity. Okay, this is the pleural cavity beta, and this is your lung. Definitely, if there is any injury to the pleura, what happens? A lot of air keeps on collecting. A lot of air keeps on collecting inside the pleural cavity. And जब बहुत ज़्यादा air keeps on collecting inside the pleural cavity beta, all of that will exert a lot of pressure on the lung. And definitely, as it exerts a lot of pressure on the lung, will your lung be able to expand? No. So that is the reason the lung is collapsed. And जब lung collapsed हो जाती, you will not be able to breathe properly. That is the reason why the respiratory rate of the patient will be very, very less. ठीक है? So that's the basic idea. Apart from this, यहाँ क्या होता है तुम्हारा छोटू सा heart. So definitely, if there is too much of air, beta, if there is too much of air, definitely, तो क्या हो जाएगा? It is going to push the heart towards the opposite side, or it is going to compress the heart. As the heart will be compressed, beta, is your heart able to relax now? No. As your heart is not able to relax, okay, will the blood come inside the heart, beta? No. As heart is compressed, as the heart is not able to relax, blood is not able to come inside the heart. If incoming blood is less, outgoing blood is also less. Incoming blood is known as venous return. Outgoing blood is known as cardiac output. And we have studied that cardiac output is directly proportional to the blood pressure. So अगर patient का cardiac output low है, so definitely his BP will also be, that can explain why the patient's BP is actually low over here. Okay? And if the blood is not able to come inside the heart beta, all that blood will keep on collecting in the superior vena cava. And अगर यहाँ blood collect होता, तो all that blood will also keep on collecting in the neck veins beta. Neck veins कैसे हो जाएंगे? Neck veins will have a lot of blood. These will be full or congested neck veins beta. ठीक है? That will be the feature. When I'll auscultate the chest of the patient, but affected side, when I'll auscultate the chest of the patient, will I be able to hear any air entry inside the lung? No, क्योंकि lung क्या है बेटा? पूरी तरह से collapsed है. Will I be able to hear any breath sounds on the affected side? No again, because air ही नहीं जा रही अगर lung में, तो will there be any breath sounds? No, nothing will be there inside the lungs बेटा. That is the reason definitely the patient, sorry, the patient will be having difficulty in breathing. ठीक है? तो याद रखना, what are these? A, B, C. Or we know the clinical diagnosis of A, B, C. A for what? Absent. क्या था? अरे रे 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 रे, क्या हो गया भाई? बायोकेम ने भुला दिया या? Absent air entry and absent breath sounds on the affected side. ठीक है? Absent air entry and absent breath sounds on the affected side. B stands for what, beta? As the lung is collapsed, will the patient be able to breathe properly? There will be breathlessness. And definitely C stands for what, beta? If the blood is not able to come inside the heart, all that fills up inside the neck veins. Therefore, there are congested neck veins. So congested neck veins, breathlessness or shortness of breath or a low respiratory rate. मैंने क्या बोला था? Breathlessness they can describe in any form. They can say there is low respiratory rate, there is decreasing SpO2, there is shortness of breath, there is respiratory distress. तुम्हें समझना है कि वो breathlessness है, ठीक है? And definitely absent air entry and absent breath sounds. Two of them तो वो present in the question. And third का भी hint था, because the patient is having low cardiac output, so all that blood will be collected in the neck veins itself. What is this classical diagnosis of? Tension pneumothorax. Okay, pneumothorax. Why? Because air is collected inside the pleural cavity, a thoracic cavity. Therefore, pneumothorax. Why tension? Tension pneumothorax is any pneumothorax which is going to compress the heart. जो भी pneumothorax heart को compress करेगा बेटा, that is going to decrease the BP, is what is called as tension pneumothorax. ये हमने definition में लिखा है. Rapid collection of air inside the pleural cavity which leads to collapse of lung and leads to a hemodynamic compromise is what is called as tension pneumothorax. So here your diagnosis is tension pneumothorax. And if the diagnosis is tension pneumothorax, what should be your immediate priority in management? Very good. Take a wide bore needle beta and insert that needle inside the intercostal स्पेस. जैसे ये नीडल इंटरकोस्टल स्पेस में डालोगे बेटा, डेफिनेटली a space will be created and all the air which is collected, it is going to come outside. Okay, so definitely this is called as insertion of needle. It's called as thoracentesis. So this is needle thoracentesis which is done in the emergency for the management of tension pneumothorax. See, agar needle thoracentesis karoge beta, air will come outside the pleural cavity. Now your lung will get enough space to relax, and just see lung will get enough space to relax or expand, definitely the patient will be able to breathe normally. और जब patient सांस ले पाएगा, definitely his respiratory status is going to improve. दूसरी definitely बात याद रखनी है बेटा, as definitely the air will come out of the pleural cavity, the pressure on the heart will also decrease, and as the pressure on heart decreases बेटा, now your heart will be able to relax, तुम्हारा heart और open हो पाएगा, and therefore the blood can easily enter inside the heart, therefore there will be increased cardiac output, और cardiac output बढ़ गया मतलब BP भी patient का क्या हो जाएगा, बढ़ जाएगा. That is important. So इसीलिए thoracentesis is not only going to improve his respiratory status, it is also going to improve his hemodynamic status बेटा, उसका BP भी बढ़ाने में मदद करता है. That is the reason why needle thoracentesis is immediate priority. Chest X-ray के लिए wait करते हैं क्या अपन? No, I have told you. इसीलिए clinical diagnosis के लिए क्या use किया जाता है? A, B, C. Okay, even without a chest X-ray, you can make a diagnosis of tension pneumothorax. Okay, in the emergency and insert a wide bore needle. ठीक है, तो that has to be remembered. Sorry. Important is but option A says peritoneal lavage. Were you having peritoneal lavage? क्या होता है? Peritoneal cleaning. Were you having any signs of peritonitis जहां तुम peritoneal lavage के लिए जा सकते थे? No. What are the signs of peritonitis in a person बेटा? ये देखो, जब भी intestine will get ruptured or stomach will get ruptured or perforated, all that fluids, all that secretions, all that food will get leaked out into the peritoneum. That causes peritonitis. Peritonitis होगा तो there will be a severe and acute abdominal pain. Along with that, there will be nausea and vomiting. Along with that, when you try to palpate the abdomen of the patient, beta, पूरे abdomen में there will be pain. And if पूरे abdomen में there is pain, that is called as diffuse tenderness. Okay. Along with diffuse tenderness now, when you try to palpate the abdomen of the patient, the person is going to contract his abdominal muscle. तो तुम abdomen palpate कर पाओगे क्या ढंग से? नहीं. तो what is that called as? शाबाश, guarding. And when you will palpate the abdomen, कड़क लगेगा. That is which rigidity बेटा? Cardboard like rigidity will be there बेटा. ठीक है? There will be a cardboard like rigidity. तुम मुझे ऐसे zoned out क्यों लग रहे हो? What happened? See, expect, मैंने भी अगर सब्जेक्ट पढ़ाया हो ना, I am not here to please you. That's very basic. Examiner मेरे नोट से उठा के पेपर नहीं बनाएगा. That's basic idea. तुमने मुझसे पढ़ा हो या किसी और से पढ़ा हो, एग्जाम ऐसा ही आएगा. Please be aware of that fact. तुम्हें लग रहा होगा कि अगर डायरेक्ट नोट से उठा के क्वेश्चन बना सकता था, वो मैं बना सकता था. And that was just to give you pseudo confidence. वो मैं कभी नहीं दूंगा. I am going to give you reality checks from time to time. क्योंकि अगर वो pseudo confidence अभी आ गया, तुम पढ़ना ही छोड़ दो. ठीक है? I don't want to please people over here. मैं बहुत क्लियर हूँ इस मामले में. मुझे कोई people pleasing नहीं करनी है यहाँ पे, ना मुझे अगला बैच बनाना, तो मैं उसकी टेंशन नहीं लेता हूँ. ठीक है? मोर इंपॉर्टेंट है अगर तुम पास हो जाते हो, दैट्स मोर इंपॉर्टेंट फॉर मी, नॉट कि तुम अभी खुश हो रहे हो. अभी कोई मतलब नहीं, अभी खुश होना ही भी नहीं चाहिए. अभी अगर तुम्हारे 40 मतलब 45 में से 40 भी आ जाते हैं ना, डोंट बी हैप्पी. ट्राई फॉर दैट एक्स्ट्रा 5 ऑलवेज. अगर वो हंगर रहेगा हमेशा, तभी पढ़ाई चलती रहेगी. अदरवाइज एक पॉइंट आएगा, यार सब तो आता है, क्यों ही पढ़ना है. जिनको सब आता था वो भी बॉर्डर पे रह गए. याद रखना ये बात. दैट्स द बेसिक आइडिया. इसीलिए लेट दैट हंगर बी अलाइव. मैं क्या बोलता हूँ, तुम बोलते हो ना कि सर आपको कैसे याद रहता है, आज भी पढ़ के आता हूँ, कल भी बेली खोली है मैंने. दैट्स द इम्पोर्टेंट थिंग. वो हंगर हमेशा रहना चाहिए भाई. दैट्स इम्पोर्टेंट. चलो, ऑप्शन इज पेरिटोनियल लवाज. तो कोई भी पेरिटोनाइटिस का साइन था क्या बेटा? नहीं. तो क्लीनिक में क्यों जाओगे तुम? दैट इज द रीजन, डोंट गो फॉर अ पेरिटोनियल लवाज. वी नो दैट चेस्ट एक्सरे इज दैट आवर प्रायोरिटी बेटा. जब तक पेशेंट का चेस्ट एक्सरे करेंगे तब तक पेशेंट ऊपर चला जाएगा. दैट इज इंपॉर्टेंट. एंड नेक्स्ट इंपॉर्टेंट इज वी नो कि क्लिनिकल डायग्नोसिस ऑफ टेंशन pneumothorax कैन बी मेड एंड वी कैन डायरेक्टली गो फॉर thoracocentesis. डू वी नीड अ चेस्ट एक्सरे टू मेक अ diagnosis? No. So not a chest X-ray. Endotracheal intubation बेटा, endotracheal intubation हम करेंगे, but important is it the immediate priority? No again, क्योंकि तुम endotracheal intubation कर दोगे बेटा, tube will go inside, it will put a pressure on the lung, but does lung have space to expand now? लंग के पास जगह ही नहीं, वो एक्सपैंड कहाँ करेगी? तुम कितना भी प्रेशर डालो बाहर से बेटा, लंग के पास जगह ही नहीं है, तो पहले जगह तो बनाओ, then if the patient is not improving, then you can go for endotracheal intubation. Got it? So that's the basic idea बेटा, ठीक है? चेस्ट एक्सरे पे डेफिनेटली वी नो बेटा कि व्हाट विल बी द फीचर्स. यहाँ पे ये बताओ मुझे, राइट या लेफ्ट, कौन सा साइड में दिक्कत लग रही है? राइट साइड में लग रही है. वेरी गुड. राइट साइड में क्या लग रहा है? मोर ब्लैकनिंग और मोर वाइटनिंग? मोर ब्लैकनिंग. मोर ब्लैकनिंग इज ड्यू टू मोर प्रेजेंस ऑफ एयर. एंड इज द एयर प्रेजेंट इनसाइड द लंग? नो, इट इज प्रेजेंट सराउंडिंग द लंग. और ये जो शैडो दिख रही है, व्हाट इज दैट शैडो सजेस्ट ऑफ? सॉरी, that shadow is suggestive of a collapsed lung beta. That shadow is suggestive of a collapsed lung. Next important, ये क्या दिख रहा है बेटा? What is this? This is the trachea. और trachea कहाँ shift हो गया बेटा? Opposite side. That is called as a contralateral tracheal shift. Contralateral tracheal shift can be seen in a simple pneumothorax or what? No, it is only seen in a टेंशन न्यूमोथोरैक्स. जब इतना ज्यादा प्रेशर होता है कि ट्रेकिया भी दूसरी तरफ पुश हो रहा हो, मीडियास्टिनम भी पुश हो रहा हो, so mediastinal shift या tracheal shift beta, it is only seen in a tension pneumothorax. ठीक है? Again the other hints. Important is normally diaphragm should appear like a dome, but on the affected side what can you see beta? There is flattening of diaphragm. इतनी हवा भर गई है, इतना प्रेशर है कि diaphragm कैसा हो गया? एकदम फ्लैट हो गया बेटा. There is a flattening of diaphragm which is seen usually. Apart from that, costophrenic angle जो होता है बेटा, this costophrenic angle which is there, this is deep or blunt? Deep. क्या बोलते हैं उसको? Very good. This is classically called as the deep sulcus sign. शाबाश. Deep sulcus sign. Does not matter तुम्हारे कितने मार्क्स आए. Just be active throughout the class. That's what I am expecting. ठीक है? That's important. नहीं आ रहा ना, ठीक है ना, सीखने बैठो ना. कौन बोला यहाँ पे ये करने आए? पढ़ाने थोड़ी आए, सीखने आए. That's fine. नहीं आ रहा, ठीक है. So that's important. So deep sulcus sign will be seen beta. Definitely that has to be remembered. ठीक है? And that is increased blackening. Increased blackening को क्या बोलते हैं बेटा? Hyperopacity or hyperlucency? Very good. On affected side, we'll be able to see hyperlucency. So hyperlucency on affected side, collapsed lung, flattening of diaphragm, deep sulcus sign, contralateral tracheal or mediastinal shift, and present or absent bronchovascular markings. Absent bronchovascular markings. All of these are suggestive of tension pneumothorax. Shabash. Tension pneumothorax does not require a chest X-ray for diagnosis. You can directly go for emergency management. That is taking a wide bore needle and inserting in between the intercostal space. That is called as needle thoracocentesis. अगर मैं needle thoracocentesis की बात करता हूँ definitely बेटा, please tell me that needle thoracocentesis we know it has different site in an adult and different site in a child बेटा. अगर मैं adult की बात करता हूँ, it is with space, fifth intercostal space. Those who are new, this is a basic difference. याद रखना कि ATLS protocol and Bayesian law clearly says fifth intercostal space just anterior to the mid axillary line. On the other hand, Harrison का recent edition says second intercostal space still on the mid clavicular line. But basic logic मैंने पहले भी दिया है कि this patient is of trauma. Patient of trauma mainly gets tension pneumothorax, not other patients usually. And trauma का patient surgery वाले के पास आएगा and that patient will be treated according to which protocol? ATLS. तो अगर ATLS protocol के according treat होगा तो इसका डिफरेंस नहीं हो सकता. ठीक है? So it should be fifth intercostal place just anterior to which line? Mid axillary line beta. Just anterior to the mid axillary line. But if they ask you about a child beta, very good. In child it is the second intercostal space. On which line? On the mid clavicular line. Very good. Important is if I ask you beta, ये इस बार का recent question है, FMG July 30th July examination. Now this is my upper lip beta, this is my lower lip. Please tell me I should insert the needle on the upper border of upper rib, upper border of lower rib, lower border of lower rib, lower border of upper rib. शाबाश. We know beta कि ये जो होता है, here we are going to have the neurovascular bundle, mainly intercostal vessels होंगे यहाँ पे. That is the reason we have to insert our needle over here beta along the upper border of लोअर रिब. पहले इंटरकोस्टल स्पेस पैल्पेट करो, नीचे वाली रिब देखो और उसके अपर बॉर्डर से जाने दो तुम्हारी नीडल. नो इश्यूज विद दिस एनीबॉडी? दैट इज इंपॉर्टेंट. ठीक है? वेयर एज एक बार तो तुमने नीडल डाल दी बेटा, बट नीडल से इतनी हवा बाहर आएगी क्या? नहीं आ सकती ना. So definitely you have to go for a definitive management जिससे जितनी भी हवा है बेटा सब बाहर निकालो. So what is the definitive management now? Very good. You are going to insert a ICT beta. ठीक है. ICT is intercostal drainage tube. So ICT insertion is done with the underwater seal. Very good. So ICT insertion with the underwater seal has to be done. And if I talk about the ICT insertion with the underwater seal, please tell me it should be inserted in which space? Fifth intercostal space. In which triangle beta? Triangle of safety, definitely. Triangle of safety. Anterior border is formed by pectoralis major, posterior border latissimus dorsi, base fifth intercostal space, apex by the base of axilla. Shabash. And this is what is the picture of your ICD beta या ICD. ठीक है, ये है तुम्हारी intercostal drainage tube. Either you can have a container or you can have a bag, ICD bag. यहाँ क्या होना चाहिए बेटा? पानी होना चाहिए, water होना चाहिए. Okay, never insert it without water. What is this case of cardiac tamponade? Sorry. अगर cardiac tamponade की बात करते हो, tamponade is nothing else but pressure. और यहाँ पे किस पे pressure पड़ रहा है बेटा? Heart पे. So definitely we know that there is a covering of the heart called as a pericardium. If there is some penetrating trauma to the pericardium beta, definitely there will be a lot of collection of blood. And अगर बहुत ज्यादा blood जमा हो जाता है in the pericardiac cavity, will your heart get enough space to relax? No, your heart will be compressed from outside, and as the heart gets compressed from outside beta, definitely in that condition, as your heart is not able to relax, can the blood come inside heart beta? No. So incoming blood is less. Outgoing blood is, incoming blood को क्या बोलते हो? Very good. Outgoing blood को, so if cardiac output is less, patient का BP will be less. Decreased BP is known as hypotension. Shabash. Second important now. Definitely if the blood is not able to come inside heart, पूरा blood कहाँ जमा हो जाएगा? It will collect in the superior vena cava, and from there into the internal jugular vein. What will happen with the JVP? Pulsatile or non-pulsatile? Very good. There will be a non-pulsatile rise in JVP beta. Only two conditions in whole medicine जहाँ पे there is non-pulsatile increase in JVP. Normally जब भी JVP बढ़ता है, pulsations are seen in the internal jugular vein. But दो ही condition है जहाँ पे only dilatation of the vein will be seen, no pulsations will be seen. One is a case of cardiac tamponade, and second is a case of, very good, superior vena cava thrombosis. Shabash. The third important one is beta. Now, if there is a lot of blood around the heart, when you try to auscultate the heart, will you be able to listen to the heart sounds properly? अच्छे से clear आवाज आएगी क्या? नहीं. कैसी आवाज आएगी? Muffled. So there will be a muffled heart sounds beta or a muffled S1 and S2. Hypotension, non-pulsatile rise in JVP, muffled S1 and S2 in a patient of cardiac tamponade. All three are suggestive of which triad? Shabash. It is suggestive of the Beck's triad. What is the emergency investigation in a case of cardiac tamponade? Very good. We know emergency investigation अगर वो पूछते हैं, that has to be our FAST. FAST is focused assessment with sonography in trauma. So it is the rapid ultrasound which usually takes 2 to 4 minutes. कितने पास होते हैं FAST में बेटा? 4 पास होते हैं. Very good. The first pass ऐसे याद है ना? The first pass definitely either is the subxiphoid or the pericardiac pass. Second pass, right hypochondrium or the perihepatic pass. Third, left hypochondrium or perisplenic pass. Fourth, suprapubic or the pelvic pass. Shabash. तो सबसे पहला अल्ट्रासाउंड प्रोब जो रखते हो, you keep it in the subxiphoid space to look for any blood collection around the heart to rule out which condition? Cardiac tamponade. Because we know beta cardiac tamponade is one among those conditions which are going to cause death of a patient of trauma within 6 causes of death in a patient of trauma within 1 hour. One of them was cardiac tamponade. Therefore, the first hour of trauma, अगर तुम उस patient की मदद कर देते हो, 90% of lives will be saved. That is the reason beta first hour after trauma is known as golden hour. How much are the platinum minutes? पहले 10 मिनट. Very good. ठीक है? So that has to be remembered. याद रखना. If they ask you investigation of choice in a patient of cardiac tamponade, what is your answer? Very good. It has to be a echocardiography. क्यों? Because you have to see blood collection around the heart, and उसकी वजह से chambers कैसे होंगे बेटा? Collapsed. So you have to see the collapsed chambers. That's the reason. ठीक है? Emergency management under echocardiographic guidance. क्या करते हो तुम? You are going to take a needle and a syringe, and you are going to insert that needle in the beta to drain all the blood. What is this called as? Needle? Shabash. It is known as needle pericardiocentesis. Okay. And needle pericardiocentesis is done from which space? Sub-xiphoid space. How many degree angles? Facing towards the लेफ्ट शोल्डर. शाबाश. डेफिनेटिव मैनेजमेंट की अगर मैं बात करता हूं बेटा, इन डेफिनेटिव मैनेजमेंट, अब सी जब हम 10 cc ऑफ फ्रैंक ब्लड एस्पिरेट कर लेंगे फ्रॉम द पेरिकार्डियक कैविटी, नाउ योर हार्ट विल गेट सम स्पेस टू रिलैक्स एंड द बीपी ऑफ द पेशेंट इज गोइंग टू ड्रास्टिकली इंप्रूव. बट इज इट द डेफिनेटिव मैनेजमेंट? नहीं. तो डेफिनेटली वी हैव टू रिपेयर इट, एंड रिपेयर करने के लिए क्या खोलना पड़ेगा? thorax. That is called as thoraco. So definitive management is definitely emergency thoracotomy beta. What are the 5 indications of thoracotomy? First is cardiac tamponade. दूसरा rupture of esophagus. Third is rupture of trachea and bronchi. Fourth is how much of blood output at the time of insertion of ICD? More than? At the time of insertion. डालते ही कितना blood आना चाहिए ICD में? More than 1.5 liters. Shabash. If there is more than 1.5 liters of blood coming inside the ICD as soon as you insert the ICD, or if there is more than 200 ml of blood per hour for consecutively how many hours beta? 3 hours. Okay, for consecutively 3 hours. कोई दिक्कत नहीं है इसमें. That has to be remembered. चलो. Reason being, those who have not studied trauma, please be aware 6 to 7 questions of surgery are from trauma. तो अगर तुम कहीं और से भी पढ़ रहे हो, प्लीज मेक श्योर यू रिवाइज द ट्रॉमा. और अगर उसमें ट्रॉमा नहीं है नोट्स में, प्लीज रिवाइज ट्रॉमा फ्रॉम समवेयर एल्स. ट्रॉमा होल्ड्स मोस्ट इंपॉर्टेंट. ओके, सबसे ज्यादा सिग्निफिकेंट टॉपिक अगर कोई सर्जरी से है, दैट इज ट्रॉमा. ठीक है, तो याद रखने बात. रीजन इज ट्रॉमा बस सर्जरी से नहीं क्वेश्चन सॉल्व करेगा, ऑर्थो के भी करेगा और बाकी सब्जेक्ट्स के भी करेगा बेटा. ऑब्स गायनी की भी कर देगा वो. दैट्स द रीजन. चलो, क्वेश्चन नंबर 2. द कैथेटर शोन इन द पिक्चर इज यूज्ड फॉर एनीबॉडी. What is this catheter बेटा? कौन है जिसको फोलीज लगा? थोड़ा आना सामने. Is it the Foley's catheter? क्या है वो? Very good. It is the Fogarty's vascular catheter. And definitely अगर Fogarty's vascular catheter है, नाम में ही उसके vessel है बेटा, so definitely it is going to be used for which procedure? Anybody? कौन सी procedure होती है? Repair of vessel. Repair of vessel is called as angioplasty. Angioplasty. PTCA. Percutaneous transluminal angioplasty के लिए use होता है when there is actually a thrombus or a embolus inside the vessel. और ये क्या करेगा? This catheter will go inside beta and it is going to break the thrombus. Along with that, this balloon is going to dilate the vessel alongside. ठीक है? So that is what is done beta. So it is done for removal of the embolus from the blood vessel. No issues till anybody? That was quite clear. That has to be remembered. Drainage of urinary bladder. It is done by Foley's catheter. और अगर Foley's possible नहीं है, then we can go for very good SPC. That is the suprapubic catheterization, जो directly यहाँ से डाला जाता है from the suprapubic region बेटा. ठीक है? Parenteral hyperalimentation. Parental hyperalimentation मतलब parental nutrition. Parental nutrition किससे दे सकते हो? Definitely three routes are there for parenteral nutrition. कौन से थे? Central line insertion, PICC line. What is PICC line? Peripherally inserted central catheter. And तीसरा कौन सा था? Peripheral IV line. Which is the best route preferred? अब ये तो ऐसे इसमें लोग ऐसे मत दो कि ये तो पढ़ा ही नहीं करके. What is the best route for parenteral nutrition? Central line. शाबाश. And which is the least preferred route? Peripheral IV line. Why peripheral IV line is the least preferred route? Because sugar-rich solutions you give them parenteral nutrition में, and if you give sugar-rich solution from the peripheral IV line, there will be a high risk of bacterial infection. Shabash. ठीक है, तो that has to be remembered beta. If I talk about the first one, all of these are instruments that are important. What is the first one beta? This is your Riles tube or your nasogastric tube. If I talk about the Riles or the nasogastric tube, important is beta, please tell me, Riles or the nasogastric tube will be inserted in which position? Sitting or supine? It will be inserted in sitting position with neck in flexion or neck in extension. Neck slightly flexed. Very good. Neck slightly flexed. Important is neck flex क्यों करनी है बेटा? So that the nose and the nasopharynx are in the same line, and then you are going to insert the nasogastric tube beta. Along with that, always ask your patient to sip what? Water, or to keep on swallowing, so that the tube will directly go inside the esophagus and from there to the stomach. Important is that. याद रखना कि how do we measure the length of the tube that is required to insert? From the tip of the nose till the ear lobule and down till the sternum. ये length measure करनी होती है patient में, and this is the length to be used or to be inserted. To be inserted inside the nasal cavity. कोई दिक्कत नहीं है इसमें. That has to be remembered, beta. And how to check the correct positioning of the rise tube, beta? Is it a chest X-ray? Very good. Either connect a syringe and aspirate the gastric content. जो stomach के content है उसको वापस खींचने की कोशिश करो syringe में, या फिर take an empty syringe, push air and auscultate it over the epigastrium. You will be able to hear a gush of air, beta. मतलब definitely the air is going inside the stomach. ठीक है? And then next, this is what? This is your Foley's catheter used for urinary drainage, beta. ठीक है? Any patient who is coming to with urine retention, please remember you have to insert the Foley's catheter. Not possible, go for SPC. Important is, तुम अगर patient में massive urinary retention है बेटा, are you going to drain all the urine at the same time? Why? Rupture क्यों होगा bladder? Suddenly there will be decreased volume and that causes a syncopal attack in a patient, beta. Okay, sudden decrease in volume causes syncopal attack in the patient's body. That is the reason 300 सीसी करके ड्रेन करना होता है. ठीक है, यूजुअली उससे भी कम 200 सीसी ड्रेन करो, ब्लॉक करो थोड़ी देर के लिए, वापस 200 सीसी वापस ब्लॉक करो. ठीक है, तो दैट हैज टू बी रिमेंबर्ड. डेफिनेटली ऑरेंज वाला कितना फ्रेंच है बेटा? 16 फ्रेंच यूज फॉर अडल्ट मेल. ग्रीन वाला कौन सा बेटा? 14 फ्रेंच यूज फॉर अडल्ट फीमेल. डेफिनेटली पीडियाट्रिक्स के लिए वी यूज 8 और 10 फ्रेंच, दैट इज ब्लैक एंड व्हाइट. ठीक है, and three-way Foley's which is there beta, ये किसके लिए काम आता है? Very good. Three-way Foley's is used for irrigation या bladder cleaning. जब तुम्हें bladder wash देना होता हो, जो तो तीसरा पोर्ट है वहां से क्या लगा दोगे? सलाइन. वो पूरा सलाइन कहाँ जाएगा? ब्लैडर में. एंड देन डेफिनेटली उसको भी क्या कर लोगे? ड्रेन कर लोगे बेटा. ठीक है, तो ब्लैडर वॉश जब करना होता है तो यू नीड द थर्ड पोर्ट फॉर इंसर्शन ऑफ सलाइन. व्हाट इज दिस कैथेटर ओवर हियर? अरे, इट इज द Swan-Ganz catheter. ये लो लेट आ रहा है क्या यहाँ पे? ओके. Swan-Ganz catheter की अगर मैं बात करूं बेटा, it is used to measure. Very good. It is used to measure PCWP, that is pulmonary capillary wedge pressure. Also we can measure CVP, that is central venous pressure, and right atrium and the right ventricular pressure as well. Very good. Important is that. ठीक है, याद रखना. Please tell me that PCWP and CVP is the best indicator for deciding the amount of fluid resuscitation. Very good. तो कितना फ्लूइड चढ़ाना है बेटा? ओके, सी व्हेन अ पेशेंट ऑफ हाइपोवोलेमिक शॉक कम्स टू यू और तुम्हें डिसाइड करना है हाउ मच फ्लूइड शुड बी गिवन टू द पेशेंट, तो सबसे पहले क्या चेक करोगे? पीसीडब्ल्यूपी और सीवीपी. डिपेंडिंग ऑन दैट यू विल कैलकुलेट द अमाउंट ऑफ फ्लूइड टू बी गिवन टू द पेशेंट. वंस यू हैव स्टार्टेड द फ्लूइड रिससिटेशन बेटा, एक बार शुरू कर दिया तुमने फ्लूइड रिससिटेशन, देन डेफिनेटली इफ दे आस्क यू बेटा नाउ which is the best clinical indicator, which is the best clinical indicator to determine if enough output, if enough fluid is going or not. Very good. It is urine output. ठीक है, तो याद रखना दो चीज है. अगर fluid resuscitation start करने से पहले you have to decide the amount of fluid to be given to the patient, that is pulmonary capillary wedge pressure. Not an option, go for central venous pressure. And clinical indicator once the fluid resuscitation has started. अब तुम्हें देखना है कि जितना हम fluid चढ़ा रहे हैं उतना काफी है या नहीं है. If adequate fluid has been given to the patient or not, that will be checked by urine. Normal urine output between 0.5 to 1 ml per kg per hour. Adult के लिए what should be the criteria? More than 0.5 ml per kg per hour. For a child more than 1 ml per kg per hour. कोई दिक्कत नहीं है इसमें. That has to be remembered. What is the earliest indicator or earliest sign in a phase of shock? Very good. In heart rate, that is tachycardia. Shabash. Which is the first phase of hypovolemic shock where the heart rate starts to increase? Class 1, 2, 3, 4. Class 2. Very good. And therefore, it is also called as compensatory phase of shock or a moderate shock as well. Very good. What is the first phase of hypovolemic shock where the BP of the patient will start to fall? Class 3 of hypovolemic shock, also called as severe or a decompensated phase of shock. Very good. What is the first phase where urine output of the patient will start decreasing? Class 2. Very good. That is the moderate shock. That has to be remembered. कोई दिक्कत नहीं है इसमें. Sorry. Okay. Next, what is this, beta? ये मैंने बताया था. This is the needle. This is the line. This is the syringe. Very good. This is nothing else but the central line. This is the central line का kit. एक बार बस इतना ही इमेज देके पूछा हुआ है कि what is the instrument. It is a central line, बेटा. So please remember. Okay, central line का मैंने बोला था ना अलग सा kit आता है. So this is the central line kit which is there, beta. It is always done under the ultrasound guidance. Okay, it is done when all the peripheral IV lines or when all the peripheral veins are collapsed. जब तुम्हें कोई peripheral access ही ना मिल रहा हो, then what is the best access? Central line is the best access, and it can also be used for parenteral nutrition. Central line के लिए बता दो best vein कौन सी है बेटा? Very good, very good. Best vein is the subclavian vein. But what is the risk associated with subclavian vein? Pneumothorax. Therefore, after central line insertion, we have to go for a chest X-ray. Chest X-ray after a central line insertion is done for two things. One, to check the correct placement of the central line. Second, to rule out pneumothorax. Then, which is the most commonly used vein for central line? IJV, internal jugular vein. And which is the least commonly used? Femoral vein. Why femoral vein is the least commonly used line? Very good. Increased risk of infection and thrombosis. That is the reason it is the least preferred route for central line insertion. What is this drain over here? अरे कौन सा स्पीड है इसका? अच्छा भाई. What is this drain, beta? Romovac suction drain. Positive or negative pressure is there. छोटा वर्जन हो तो मिनीवैक सक्शन ड्रेन. ठीक है. Used after which surgeries mainly? MRM or thyroid surgery. Shabash. What is this, beta? इधर मूव कर देता है. अरे भाई. This is nothing but Jackson Pratt drain. चलो. Jackson Pratt drain is used after which surgical procedure? Sentinel lymph node biopsy. Next वाला ये क्या है बेटा? Very good. It is a linear stapler used for which kind of surgeries? This is a FMG Jan 2023 question. Linear stapler used for the gastrointestinal surgeries like sleeve gastrectomy or which procedure in Zenker's? Dohlmann's procedure. Very good. Next one, beta. What is this? Circular stapler used for which kind of surgeries? Stapler hemorrhoidopexy, which is the surgery of choice for hemorrhoids nowadays. Or it can be used for which surgery in colorectal cancer? Low anterior resection. शाबाश. जहाँ क्या क्या निकालते बेटा? Sigmoid colon and the rectum. Please tell me, in low anterior resection, is the anal sphincter damaged? No. So do we need to do any colostomy? No. Colostomy कौन सी surgery में करते हो बेटा? APR, that is abdominoperineal resection. ठीक है? So that has to be remembered. Question number 3 now. It states a 60-year-old woman, beta, who is a heavy smoker. ठीक है, 60-year-old woman, heavy smoker and works as a domestic help, gets syncopal attacks. Syncopal attack क्या होता है बेटा? Patient, very good. Patient will actually get dizzy, okay, or the patient can even fall unconscious at times. Okay, the basic reason क्या हो जाता है बेटा? Because there is decreased blood supply to the brain. All of a sudden there is decreased blood supply to the brain बेटा. That causes syncopal attack. When she is scrubbing the floors using her right upper limb vigorously. Okay, जब वो right upper limb vigorously use कर रही होती है, okay, that is the time definitely she gets the syncopal attacks usually. This makes her quite uneasy and at times she even feels faint. बेहोशी जैसा लगता है. She gets dizzy बेटा. The likely cause of this condition would be important is, chalo, let's try to rule it out one by one. Option B says Raynaud's disease. Raynaud's disease, the easiest one to rule out. Reason is Raynaud's disease. Does it happen in large blood vessels? No, it happens in the small blood vessels like the arterioles and venules. They undergo sudden spasm beta. उसकी वजह से होता है. And that is the reason it is going to show us color changes. What is the sequence of color changes? White, blue, red. कोई दिक्कत नहीं है इसमें. Important is यहाँ पे कोई color changes की बात हुई है क्या? नहीं. And definitely we know it cannot affect the carotid vessel, so that there will be decreased blood supply to the brain. So obviously Raynaud's disease is not a diagnosis over here. Okay? If I talk about Buerger's disease now, Buerger's disease affect large vessels or small vessels? Small vessel. First thing, Buerger's disease usually seen in elderly patient or young patients? Young. तुम्हारे patient की age क्या है? 60 years old. कौन सी vessels involved बेटा? Large vessel. Large क्यों? Because patient is getting syncopal attack, मतलब decreased blood supply to brain. तो कौन सी blood vessels involved है? Carotid vessels or the aorta would be involved. That is the time definitely the patient can get syncopal attack. Can these vessels be involved in a case of Buerger's? Never. Buerger's में कौन सी vessels involved होती है? The small blood vessels like the tip of fingers or the tip of toes. बराबर? So any which way, Buerger's is also out of the league. ठीक है? We are left with two options: Takayasu arthritis and atherosclerosis. Takayasu arthritis, we know definitely it is a large vessel vasculitis. It is inflammation of the blood vessel. और क्या हो जाता है इस condition में? You are able to see definitely the arc of aorta beta or the branches arising from the arc of aorta, they will undergo what? Inflammation. And inflammation की वजह से क्या हो जाता है बेटा? Fibrosis. And fibrosis की वजह से narrowing या blockage हो जाता है. As there is narrowing or blockage of these vessels, wherever these blood vessels are going to supply, वहां blood supply ज्यादा पहुंचेगा या कम पहुंचेगा? Decreased blood supply will be there, and that is the reason the patient will have all the problems. These are the various types of Takayasu arthritis. They won't ask you in great details as such. अब तक नहीं पूछा, but नीट पीजी में आ चुका है. Otherwise तुम्हारे एग्जाम में तो कभी नहीं पूछा. Important is ये पता होना चाहिए बस कि Takayasu arthritis बेटा, it is a large vessel vasculitis. Okay, mainly affects which vessels बेटा? Mainly affects the subclavian artery and the arc of aorta. It can involve the carotid vessels as well, but less commonly though. Mainly affects the arc of aorta and the subclavian artery. Important is, chalo, important यहाँ पे it can affect both the vessels, and that is the reason we can definitely say beta that it can be a case of Takayasu arthritis. Okay, but Takayasu arthritis जो होता है बेटा, it causes inflammation, fibrosis, उसकी वजह से narrowing. अगर arc of aorta की, subclavian artery की या definitely sorry, तुम्हारे carotid vessel की narrowing हो जाती है, there will be decreased blood supply. If subclavian artery की narrowing है, there will be decreased blood supply to the upper limb. And अगर carotid vessel की narrowing है बेटा, there will be decreased blood supply to the brain, which can explain both of our symptoms. ठीक है, right subclavian artery blockage की वजह से the patient is having pain inside her right upper limb when she uses it too vigorously. क्यों? क्योंकि narrowing है बेटा right subclavian artery की. तो अगर वो ज्यादा काम करेगी, the muscles are going to work more. Muscle ज्यादा काम करेंगे, the demand is going to increase or decrease? Increase. तो अगर muscle की demand increase होती है, definitely they will need more blood supply. But this narrowed subclavian artery, will it be able to give enough blood supply? No. That is the reason she will start experiencing pain. As there is blockage of the blood vessels which are supplying the brain, that is the reason definitely the patient can get syncopal attacks. ठीक है? That is the reason she can get syncopal attacks, beta. All of this is fine. सब कुछ ठीक है. Problem is Takayasu arteritis and giant cell arteritis. Two conditions are the ones which are large vessel vasculitis. Giant cell arteritis is more common in patients more than 50 years of age, and that too mainly females. On the other hand, Takayasu arteritis is a condition which is more common in patients less than 50 years of age, and that too more commonly affecting the males. तो अब अगर ये diagnosis है, smoking is not a risk factor which can be associated with Takayasu arteritis always, but it is definitely the most important risk factor which can be associated with atherosclerosis. मैंने क्या बोला था? Takayasu is a common condition or uncommon condition? Uncommon. किसके बारे में सोचना ज्यादा होता है commonly? जो common है ना भाई. टीबी का diagnosis ज्यादा commonly देंगे या हिस्टोप्लाज्मोसिस का? टीबी का. That's the basic idea. So please remember the condition is nothing but atherosclerosis. That has to be your answer in this condition, beta. Reason is we know that atherosclerosis is nothing but formation of atherosclerotic plaque which causes blockage of the arteries, beta. It involves large vessels or small vessels? Large vessels, definitely. It involves patients more than 50 or less than 50? More than 50 years of age, that is elderly patient. Most important risk factor is smoking. Most common vessel which is affected, it is the aorta. Mainly it is the abdominal aorta, but it can be any part of the aorta as well. ठीक है? Followed by coronary artery, followed by the most common peripheral vessel. Very good. This was a PYQ, beta. Most common peripheral vessel affected with atherosclerosis has to be a popliteal artery. No issues with this, anybody? That has to be remembered. So definitely all these features, are they in the favor of atherosclerosis? Yes. So my more likely diagnosis has to be atherosclerosis in this condition. If a patient has been diagnosed with atherosclerosis, what is the first line? पहले तो ये बताओ, what is the investigation of choice? Not for aorta, but for other peripheral vessels. Aorta के लिए तो we know. ये हमने देख लिया था. For central blood vessels, beta, it should be investigation of choice for the central blood vessel. Very good. CT or MR angiography. For the peripheral blood vessel, investigation of choice. Duplex scan. Very good. For the gold standard investigation, angiography. Which one? Invasive, non-invasive? Invasive. Gold standard है ना, तो it would be a invasive. Which वाला? Catheter angiography. शाबाश. That's important. कोई दिक्कत नहीं है इसमें. तो यहाँ पे investigation of choice for atherosclerosis, beta. For peripheral vessels, it has to be a duplex scan. अगर carotid vessel involved है तो CT angiography ही होगा. Please be aware of that. Abdominal aorta, CT angiography. But for peripheral vessels of upper limb and lower limbs, beta, it is duplex scan. Gold standard is my angiography. That shows the blockage. Please tell me that atherosclerosis is a gradual or a sudden arterial obstruction? Gradual. So definitely the body has enough time to form what, beta? Body graft form करती है. Collaterals. Very good. Okay. So that is important. Treatment की अगर मैं बात करूं, definitely. कल कौन सी क्लास थी भाई तुम्हारी? क्लास नहीं थी ना, तो कल की नींद अब तक उतरी नहीं. अब क्या हुआ था? पार्टी करी थी क्या कल? हैंगओवर अभी भी चल रहा है? काश. चलो, ज्यादा आंसर सही होते क्या? Next important is first line management in atherosclerosis is lifestyle modifications, beta. ठीक है? So that has to be remembered. अगर lifestyle modifications करने हैं, the patient has to quit alcohol and smoking. Patient has to do weight reduction, definitely. Regular exercise, ठीक है? And avoid fried fatty food. Very good. अगर this fails, beta, then we have to go for medical management. Vasodilators, antiplatelets and statins. अगर वो भी फेल होता है, then my option is very good, PTA, percutaneous transluminal angioplasty. दो टाइप की हो सकती है, बलून और stent angioplasty. Stent भी दो टाइप की हो सकते हैं, metallic और drug eluted stent. Please tell me the name of the drug which is coating the. Very good. It is known as sirolimus. Shabash. Next, if PTA also fails, then we have to go for shabash bypass grafting. Okay, we have to go for a bypass grafting, beta. Bypass grafting is the last option that is left with us. We can even go for a lumbar sympathectomy. I'll talk about that in burgers though. वहां पे वो ज्यादा common option है. जल्दी से एक बार साइंस एंड सिम्टम्स बता देना डिस्टल इस्कीमिया की ड्यू टू atherosclerosis. सबसे पहले, when the patient starts walking, after walking a certain distance, patient has pain, but when the patient takes rest, the pain goes away. What is this? Shabash. Intermittent claudication. What is the name of grading? Boyd's grading. Shabash. Uske baad, there will be decreased blood supply to the nerves. Cry of dying nerves. That is rest pain. Uske baad, there will be coldness, numbness, paresthesia. Uske baad, pre-gangrene. That is color changes along with ulceration of skin. And finally, complete necrosis. That is gangrene. If a person comes to you with gangrene, amputation. Shabash. That has to be remembered. This is the color changes seen in a patient of Raynaud's phenomena. White, blue, red. Raynaud's phenomena is more common in males or females? Females. Raynaud's phenomena can be primary and secondary. Primary Raynaud's phenomena is also known as Raynaud's disease. Shabash. And what is the cause of primary Raynaud's phenomena? Idiopathic. It is not associated with any other condition. Cause हमें नहीं पता. Secondary. It is associated with Shabash. Connective tissue disorder. Something like scleroderma, SLE, rheumatoid arthritis. Shabash. Drug of choice भी बताओ ही दो. Calcium channel blockers. Something like nifedipine या amlodipine can be given. Followed by Shabash. Next, a 72-year-old patient with a BPH. What is BPH? Benign prostatic hyperplasia. Underwent a TURP. What is TURP? Transurethral resection of prostate. हम क्या करते हैं? यूरेथ्रा के अंदर जाते हैं. Okay, and with the help of a laser, we are going to burn the enlarged prostate, beta. ठीक है? Under spinal anesthesia, it was done. After 1 hour, beta, the patient develops vomiting and there is altered sensorium. Vomiting and altered sensorium. The most probable causes. This was your PYQ. Very good. This is a case of water intoxication syndrome. क्या होता है? Normally, याद रखना, in a case of BPH, beta. Sorry, in a case of BPH, यहाँ पे we have the prostate gland, and definitely you can see the size of the prostate has been increased because there is increase in number of size of cells of prostate. Hyperplasia, number of cells, beta. As there is increase in the number of cells, definitely there will be ultimately increase in size of the prostate gland altogether. Okay, it is more common in young or elderly males. Elderly males, beta, it is more common in patients more than 50 years of age. And definitely when the prostate gland will be enlarged, there will be narrowing of the prostatic urethra. Will the patient be able to pass the urine? So the most common symptom will be lower urinary tract symptoms, hesitancy, intermittency, urine retention, overflow incontinence, nocturia, increased frequency. Okay, so all of these features will be there in the patient, beta. ठीक है? Important is patient में याद रखना कि what are we going to do for investigation? What will be the investigation that we'll do? सबसे पहले बताओ. सबसे पहले clinical approach के साथ digital rectal examination. Okay, when we do a DRE, beta, on anterior or posterior wall, कहाँ पे feel होगा prostate? On anterior wall of the rectum will be able to feel the prostate. And what will happen with the size of prostate? Enlarged होगा. Tender होगा, non-tender होगा. Non-tender, it is not infection, right? Then we will go for a ultrasound KUBP, that is kidney, ureter, bladder and prostate. इसपे क्या दिखेगा? Size of prostate is increased. And second, when the patient will come after urination, तो bladder कैसा होना चाहिए बेटा? Empty. But इस patient का bladder empty होगा क्या? So how much will be the post-void residue? खाली करने के बावजूद there will be more than 100 ml of urine inside his bladder. मतलब, was the patient able to empty the bladder completely? No. इसके अलावा enlarged prostate can also be a prostate cancer. So you have to rule out prostate cancer by checking the levels of serum, PSA, prostate specific antigen. What is the normal value? 0 to 4 nanogram per ml. रीजन क्यों वापस याद दिला रहा हूं? बिकॉज इन वन ऑफ द क्वेश्चंस लेवल ऑफ लाइक सीरम पीएसए की लेवल दी गई थी, उससे डिफरेंस करना था, बाकी कोई डिफरेंशियल नहीं था तुम्हारे पास. ठीक है, अदरवाइज बीपीएच एंड प्रोस्टेट कैंसर सेम लग रहे थे उस केस में. ठीक है, दैट्स द इंपॉर्टेंट थिंग बेटा. सॉरी, इंपॉर्टेंट इज याद रख लो. अब ट्रीटमेंट करनी है तो डेफिनेटली वी हैव टू टेक अ लेजर बेटा. पहले तो व्हाट डायरेक्टली यू विल गो फॉर सर्जिकल मैनेजमेंट ऑफ व्हाट? नो, व्हाट इज माय फर्स्ट लाइन मैनेजमेंट? मेडिकल. एंड द ड्रग ऑफ चॉइस इज tamsulosin और दूसरा Silodosin. Both are selective, non-selective alpha blockers. Selective alpha 1 ए ब्लॉकर बेटा, वेरी गुड। अल्फा 1 ब्लॉकर्स आर प्राजोसिन, टेराजोसिन, अल्फ्यूजोसिन। उनका साइड इफेक्ट क्या होता है? पोस्ट्यूरल और ऑर्थोस्टैटिक हाइपोटेंशन। सो प्राजोसिन वगैरह दे विल बी यूज्ड इन व्हिच पेशेंट्स बेटा? वेरी गुड, पेशेंट्स हु आर हैविंग बेनाइन प्रोस्टेटिक हाइपरप्लेजिया अलोंग विद, क्योंकि बीपी वैसे भी कम करना है उनका, दैट इज द रीजन। अलोंग विद दैट वी कैन आल्सो गिव अ ड्रग व्हिच कैन डिक्रीज द साइज ऑफ द प्रोस्टेट। व्हाट इज दैट बेटा? 5 alpha reductase inhibitor which will decrease the amount of dihydrotestosterone। and ड्रग का नाम क्या है? शाबाश। कितना टाइम लेगी काम करने में? 3 महीने। दैट इज द रीजन व्हाई इट इज नॉट द ड्रग ऑफ चॉइस। दिस इज द रीजन। इमीडिएट रिलीफ जो देता है दैट इज द ड्रग ऑफ चॉइस। ट्रीटमेंट के लिए वी गो इनसाइड द यूरेथ्रा बेटा बाय टेकिंग अ लेजर, एंड जैसे ही हम प्रोस्टेटिक यूरेथ्रा तक पहुंचते हैं विद द हेल्प ऑफ दैट लेजर वी आर गोइंग टू डिस्ट्रॉय द प्रोस्टेट बेटा। बट जब हम लेजर यूज करते हैं और कॉटरी यूज करते हैं वी आल्सो हैव टू यूज अ इरिगेटिंग फ्लूइड। और जो इरिगेटिंग फ्लूइड होता है बेटा इट शुड बी हाइपोटोनिक, आइसोटोनिक, हाइपरटोनिक। आइसोटोनिक होना चाहिए। आइसोटोनिक का मतलब concentration of that irrigating fluid and concentration of plasma should be equal, same होना चाहिए। तो will there be any fluid movement? कुछ नहीं होगा। बट इन केस बेटा तो कौन सा फ्लूइड यूज कर लेते हो? हाइपोटोनिक फ्लूइड। हाइपोटोनिक फ्लूइड समथिंग लाइक डिस्टिल्ड वाटर और 5% डेक्सट्रोज। ऐसा हाइपोटोनिक फ्लूइड। हाइपोटोनिक मतलब मोर कॉन्सेंट्रेशन देन प्लाज्मा और लेस कॉन्सेंट्रेशन देन प्लाज्मा। लेस कॉन्सेंट्रेशन देन प्लाज्मा बेटा, ठीक है। और कॉन्सेंट्रेशन किसका ज्यादा है? प्लाज्मा का। मतलब देयर इज मोर कॉन्सेंट्रेशन इनसाइड द ब्लड वेसल। तो अभी मुझे तब बताओ ऑस्मोसिस की वजह से, ठीक है, डेफिनेटली ऑस्मोसिस क्या करता है बेटा? दोनों तरफ का कॉन्सेंट्रेशन क्या करना चाहता है? इक्वल करना चाहता है। इट ऑलवेज वांट्स टू डू इक्वल कॉन्सेंट्रेशन ऑन बोथ द साइड्स। तो अब उसके लिए क्या होगा? ऑल द फ्लूइड दैट वी आर यूजिंग, ऑल दिस हाइपोटोनिक फ्लूइड दैट वी आर यूजिंग बेटा, ये कहां चला जाएगा? It will start going inside the blood vessel or inside the plasma. Why? Because the concentration is in the plasma is high or low? High. तो उसको क्या करना है अपने को? कम करना है। अगर प्लाज्मा को कॉन्सेंट्रेशन कम करना है बेटा तो प्लाज्मा को कॉन्सेंट्रेट करना पड़ेगा, डाइल्यूट करना पड़ेगा। डाइल्यूट, और डाइल्यूट करने के लिए पानी ऐड करना पड़ेगा। तो वो पानी, ये जो पानी जो यूज कर रहे हो बेटा, ऑल दैट फ्लूइड विल गो फ्रॉम यूरेथ्रा टिल द ब्लड वेसल, दैट विल कॉज प्लाज्मा डाइल्यूशन। तो प्लाज्मा में किसकी लेवल्स बढ़ रही है बेटा? वाटर की। बट आर सोडियम लेवल्स इंक्रीजिंग। तो सोडियम लेवल्स तो वैसे नॉर्मल है बेटा, बट मैंने बोला है कि सोडियम लेवल्स तुम अकेले देखते हो क्या? नो, यू ऑलवेज सी द सोडियम लेवल्स अलोंग विद वाटर। तो अगर दोनों का रिलेशन देखेंगे बेटा, द वाटर लेवल्स आर वेरी वेरी हाई बट द सोडियम लेवल्स आर नॉर्मल। दोनों के बीच का डिफरेंस बहुत ज्यादा है। तो कैन वी से दिस इज अ रिलेटिव और अ डाइल्यूशनल हाइपोनाट्रीमिया? यस। ओके, so ड्यू टू दिस प्लाज्मा डाइल्यूशन बेटा, जैसे प्लाज्मा डाइल्यूशन हो जाता है due to excess of fluid going inside the plasma, इसकी वजह से definitely there is a relative hyponatremia। and when there is decreased amount of sodium, what is the normal value of sodium? Very good, 135 to 145 milliequivalents per liter। so if there is a hyponatremia in the patient beta, okay, dilution की वजह से, so the patient will start getting CNS symptoms like altered sensorium, there will be vomiting, there can be confusion, there will be drowsiness, ठीक है, a patient can even get seizures। very good। तो in this condition बेटा, this is nothing else but बहुत सारा water कहाँ चला गया? blood vessel में, and there was a water intoxication। so this is known as water intoxication syndrome, or which syndrome? TURP syndrome। sorry। if a patient is having mild hyponatremia बेटा, कैसे treat करोगे? माइल्ड हाइपोनेट्रीमिया में ज्यादा सोडियम की लेवल्स कम नहीं है तो और फ्लूइड देना बंद कर दो बेटा, क्योंकि ऑलरेडी बहुत ज्यादा क्या है? फ्लूइड है। तो वी शुड डू फ्लूइड रेस्ट्रिक्शन। बट अगर बहुत ज्यादा सोडियम की लेवल्स कम है बेटा, देन वी हैव टू गिव सोडियम फ्रॉम आउटसाइड। कौन सा ऐसा फ्लूइड है बेटा जिसमें बहुत ज्यादा सोडियम होता है? 3% हाइपरटोनिक सलाइन। शाबाश। इंपॉर्टेंट इज दिस वाज अबाउट ट्रीटमेंट ना, बट प्रिवेंट कैसे करोगे? होने ही नहीं देना वाटर इंटॉक्सिकेशन। तो कौन सा फ्लूइड यूज करना है? आइसोटोनिक। तो प्रिवेंशन के लिए वी यूज आइसोटोनिक। कौन सा? शाबाश, दिस वाज अ पीवाईक्यू अगेन। व्हाट इज डन फॉर प्रिवेंशन ऑफ वाटर इंटॉक्सिकेशन सिंड्रोम? आंसर इज यूज आइसोटोनिक ग्लाइसिन। कोई दिक्कत नहीं है इसमें? दैट हैज टू बी रिमेंबर्ड, कोई दिक्कत नहीं है। हाइपरकलीमिया बेटा कभी भी सीएनएस के सिम्टम्स करता है क्या? नो, हाइपरकलीमिया मतलब इंक्रीज पोटेशियम लेवल्स दैट विल एक्चुअली कॉज अरिथमिया इन द पेशेंट बेटा, ठीक है, वो सीएनएस के सिम्टम्स नहीं कर सकता, ठीक है। इंपॉर्टेंट इज, यहाँ हाइपरकलीमिया का कोई लॉजिक भी नहीं बनता है, ठीक है। रप्चर ऑफ यूरेथ्रा अगर होता डेफिनेटली, तो द पेशेंट वुड हैव गॉन इनटू सिंकोपल अटैक, ऑल्टर्ड सेंसोरियम जैसे सीएनएस सिम्टम्स का कोई मतलब नहीं बनता है। द पेशेंट वुड हैव गॉन इनटू सिंकोपल अटैक, क्योंकि अचानक से यूरेथ्रा रप्चर है, maybe the patient would have had a lot of bleeding, ठीक है, and definitely the patient would have urine collection, okay, in everywhere। याद रखना यूरेथ्रा का जो रप्चर होता है बेटा, एंटीरियर एंड पोस्टीरियर यूरेथ्रा दोनों में से ज्यादा कॉमन कौन सा है? एंटीरियर पोस्टीरियर? एंड एंटीरियर यूरेथ्रा रप्चर, एंटीरियर में ज्यादा कॉमन पेनाइल या पेरिनियल? पेरिनियल। पोस्टीरियर में से ज्यादा कॉमन मेम्ब्रेनस। ओवरऑल मोस्ट कॉमन पेरिनियल या बल्बार यूरेथ्रा का रप्चर बेटा, ठीक है। मैंने ये बोला है कि जब भी यूरेथ्रा का रप्चर हो रहा होता है बेटा, देयर कैन बी यूरिन कलेक्शन इन एवरी साइट एक्सेप्ट, ये पीवाईक्यू एनाटॉमी का, अप्लाइड एनाटॉमी का। जब भी यूरेथ्रा का रप्चर होता है, द यूरिन कैन कलेक्ट एवरीवेयर। ऑप्शंस जो दे तुम्हारी, स्क्रॉटल सैक, एंटीरियर एब्डोमिनल वॉल, सुपरफिशियल पेरिनियल पाउच, डीप पेरिनियल पाउच, व्हाट इज योर आंसर? वेरी गुड। यूरिन कलेक्शन सब जगह होगा एक्सेप्ट द डीप पेरिनियल पाउच। डीप पेरिनियल पाउच में कभी यूरिन कलेक्शन नहीं होता आफ्टर रप्चर ऑफ urethra, that I have discussed already, ठीक है। no issues with this anybody, that has to be remembered, this is not even an overdose of anesthesia। this is what is the TURP beta, as you can see definitely a curate which is there। आजकल curate नहीं यूज करते, आजकल we use laser, ठीक है। if I talk about prostate cancer बेटा, prostate cancer is the most common cancer in elderly males। जो सबसे कॉमन कैंसर है elderly males का, it is actually prostate cancer बेटा। prostate cancer is such a cancer which can be treated by which therapy बेटा? Hormonal therapy। another cancer in females, that is breast cancer, ठीक है। these cancers can be treated by hormonal therapy। prostate cancer सॉरी, prostate cancer जो होता है, बीपीएच कौन से जोन में कॉमन है बेटा? Very good। BPH is more common in the transitional zone बेटा, very good। BPH is more common in the transitional zone of prostate। तीन जोन होते हैं ना prostate के, central, transitional and peripheral। whereas prostate cancer PPP मतलब it is more common in the peripheral zone of prostate। and which lobe of prostate? posterior lobe of prostate। शाबाश, PPP याद रखना, ठीक है, कोई दिक्कत नहीं है इसमें, that has to be remembered। if I ask you about prostate cancer बेटा, what is the investigation of choice for prostate cancer? Here also the patient is going to have lower urinary tract symptoms, same होगा, क्योंकि size of prostate increases, compresses the prostatic urethra। investigation of choice, very good, it is a truss guided biopsy। what is a truss? transrectal ultrasound guided biopsy will be done beta। and what is the investigation of choice for staging? truss itself beta, transrectal ultrasound ही investigation of choice for staging। which are the sentinel lymph nodes? whatever we are discussing today, ये important चीजें हैं। so that is the things that I'm discussing। I know we have discussed it recently, but reason is there are definitely new people over here, test and discussion people, they have to be aware of that। second important thing, जब तुम बाद में एग्जाम के लिए जाओगे बेटा, तो जब टीएनडी निकालोगे, टीएनडी की जब पीडीएफ्स खोलोगे, तो उसका कोई सेंस बनना चाहिए तुम्हारे लिए। इफ यू आर ओपनिंग द पीडीएफ्स, यू जस्ट डोंट नीड टू सी द आंसर्स। मैं पता तो हो अगर गलत गया था मेरा, ठीक है, क्यों गलत गया था, तो इमीडिएटली एक्सप्लेनेशन मिल जाए। दैट इज द रीजन, ये 10 दिन पहले टीएनडीज एक बार रिवाइज कर लेना एग्जाम के, ठीक है। सो दैट्स द बेसिक थिंग व्हाई आई राइट ऑल द इंपॉर्टेंट थिंग्स। सेंटिनल लिम्फ नोड्स आर व्हिच लिम्फ नोड्स बेटा? ब्लैडर कैंसर एंड प्रोस्टेट कैंसर, इट इज द वन थिंग, दैट इज obturator lymph node। shabash, it is the obturator lymph node which will be the sentinel lymph nodes of prostate cancer बेटा, कोई दिक्कत नहीं है। treatment, if the prostate cancer is in the early stages, we can go for a radical prostatectomy। जब तक prostate cancer prostate gland में ही है, we can go for a radical prostatectomy, that is removal of prostate gland along with the lymph nodes। but if it is a advanced prostate cancer, मतलब जो आसपास फैल चुका है, तो advanced prostate cancer में बेटा, in that condition, अब तक distant metastasis नहीं हुआ, आसपास फैला है बस, seminal vesicles वगैरह। so in this condition we go for a androgen ablation। androgen ablation is done by GnRH antagonist or GnRH analogs? analogs, continuous or pulsatile manner? continuous manner। या दूसरा चीज, we can use a radioactive substance for brachytherapy in prostate cancer। what is that radioactive iodine called as? iodine 120। shabash, that is the important thing beta। so brachytherapy in a prostate cancer, PYQ है, brachytherapy in a prostate cancer is given by iodine 125। This is the only indication of iodine 125 for treatment. Otherwise, for treatment, which radioactive iodine is used? Iodine 131 for thyroid conditions. Important is prostate cancer can metastasize. What is the most common site of metastasis? It is the lumbar vertebra. Why? Which plexus of veins? Battison's plexus of veins. Definitely. Osteoblastic or osteolytic metastasis more commonly. याद रखना prostate cancer is the most common cause of osteoblastic metastasis in the body. Bone forming or bone breaking? अरे भाई आईपैड मेरा है ना भाई, नेट उनका है, मैं क्या पढ़ूं? Osteoblastic metastasis का most common cause in the body is प्रोस्टेट कैंसर. अगर वो पूछते बेटा बाकी सब कुछ सेम, हिमेटोजेनस स्प्रेड, स्पाइन में मेटास्टासिस, लंबर वर्टिब्रा में बैटिसन प्लेक्सस ऑफ वेन्स, बस ऑस्टियोलाइटिक मेटास्टासिस दिख रहा है, देन दैट इज अ मेटास्टासिस फ्रॉम ब्रेस्ट कैंसर. शाबाश. आई हैव टोल्ड यू ऑलरेडी. कैसे पता लगाना है मेटास्टैटिक प्रोस्टेट कैंसर? elderly male coming to you with lower urinary tract symptoms along with the low back ache is a feature. Only an elderly male coming to you with a low back ache. My first differential has to be multiple myeloma. And a young adult male coming to view with low backache, ankylosing. Shabash, that has to be remembered. Okay. Question number 5, if I talk about beta. A 55-year-old patient, okay, presents with dysphagia, that is difficulty in swallowing to both solids as well as liquids. दोनों खाने में दिक्कत है patient को. Barium swallow was done, which shows the following finding. Preferred treatment is barium study. जल्दी से esophagus के लिए barium swallow, stomach के लिए barium, स्मॉल इंटेस्टाइन बेरियम, मील फॉलो थ्रू, लार्ज इंटेस्टाइन बेरियम. तो यहाँ पे बेरियम फॉलो किया फॉर इसोफेगस. व्हाट इट शोज बेटा? शायद क्या है बैठा हुआ इसोफेगस में? डेफिनेटली देयर कैन बी अ मास. मैंने दो जगह बोला है ना बेटा, कॉन्ट्रास्ट कहाँ कहाँ नहीं जाता? फर्स्ट इफ देयर इज एनी मास एंड सेकंड इफ देयर इज एनी अल्सर. तो उसमें क्या दिखता है तुम्हें? फिलिंग डिफेक्ट. वैसा ही कुछ दिख रहा है यहाँ पे. ओके, एंड उस फिलिंग डिफेक्ट की वजह से, और दूसरा क्या दिख रहा है? देयर इज नैरोइंग ऑफ द esophagus beta. Which part? Upper, middle or lower? Very good. It is the mid one third of the esophagus जहाँ पे narrowing दिख रही है बेटा. And mid one third of esophagus में narrowing. Okay, so not narrowing. It is which kind of appearance? Rat tail या bird beak? ठीक है. जो bird beak बोल रहे हैं थोड़ा बता दो. पंछी की चोंच टेढ़ी होती है सीधी होती है भाई? सीधी होती है. तो टेढ़ी चोंच तो किसी पंछी की नहीं होती. तो इफ दे यू आर यूजिंग ऑल्टरनेटिव टर्म्स दैट कैन नॉट बी अ बर्ड, दैट कैन नॉट बी यूज्ड बेटा. सो याद रखना इसोफेजियल कैंसर में डेफिनेटली इट इज ऑलवेज अ रैट टेल अपीयरेंस. इफ आई टॉक अबाउट इसोफेजियल कैंसर, इट कैन बी अ स्क्वैमस और एडिनोकार्सिनोमा बेटा. मोर कॉमन कौन सा है? So more common in India, squamous. More common worldwide, squamous. Reason being, the normal lining of your esophagus is squamous itself. That is the reason. ठीक है? याद रखना, if they say most common in the Western world, then your answer is adenocarcinoma. Why in the Western world? Food habits mainly. Why? Because all that junk food habits are going to cause GERD. And उस GERD की वजह से Barrett's esophagus. Barrett's esophagus की वजह से dysplesia, and dysplesia की वजह से adenocarcinoma finally. Shabash. Important, squamous cell carcinoma is more common in which part of the esophagus? Middle one third. And adenocarcinoma in the, because GERD and Barrett's both happen in the lower one third of the esophagus. सरकारी रिस्क फैक्टर तो सबको पता है दोनों के लिए. Smoking and I am more interested in specific risk factors. Squamous cell carcinoma के लिए which condition is the risk factor बेटा? Very good. When the lower part of the esophagus is in spasm, all that food collects in the middle and upper part of the esophagus, causing damage, inflammation, healing होगी तो proliferation, and proliferation अगर extensive हो जाता है तो cancer. ठीक है? What is that condition? Achalasia cardia. Second is definitely Zenkus also. Very good. And for adenocarcinoma, it is always GERD, which can further lead to Barrett's esophagus, which is the risk factor. कोई दिक्कत नहीं है. esophageal कैंसर में वेट लॉस मोर ज्यादा होगा कम होगा? ज्यादा. इन्वेस्टिगेशन ऑफ चॉइस बताओ बेटा. अपर जीआई एंडोस्कोपी प्लस बायोप्सी. डिस्टेंट मेटास्टासिस के लिए इन्वेस्टिगेशन ऑफ चॉइस PET scan. PET scan, positron emission tomography scan, the whole body scan for distant metastasis. What is the dye used? 18 chlorodeoxyglucose. What is the half-life? 110 minutes. These are PYQs. Important. Okay? What is the investigation of choice for depth of invasion or the tumor and nodal staging in a case of esophageal or gastric cancer? Endoscopic ultrasound. Shabash. Overall staging, that is TNM staging के लिए PET CT. Shabash. Important is recent question 30th July examination. GIT cancers में the tumor staging or the T staging is decided by options: size of the tumor, number of structures involved, or the depth of invasion. Depth of invasion. कितना deep cancer है? Mucosa, submucosa, muscularis and serosa. The treatment for esophageal cancer is always removal of the esophagus, that is esophagectomy. Upper 1/3 के लिए surgery का नाम acute surgery. Middle 1/3 के लिए Iver-Lewis surgery and lower 1/3 के लिए Oringer or the trans-hiatal surgery. शाबाश. तो यहाँ पे कौन सा पार्ट में है बेटा? Middle 1/3. So it is more likely a squamous cell carcinoma to be likely. हमें नहीं पता because we have not done the biopsy, but when we'll do, it will confirm it. And what is the option or what is the treatment that we do? Option B, that is Iver-Lewis operation. Heller's cardiomyotomy is the treatment of choice, beta. जहाँ पे we are going to make incision on the circular muscles in the lower part of the esophagus. If we make incisions in the lower part of esophagus, the muscles are going to relax. And if the muscles are going to relax, the pressure will decrease and the esophagus can open up. What is this condition in which the lower part of esophagus is in a state of constant spasm? Achalasia. So Heller's cardiomyotomy is the is the treatment of choice for achalasia cardia. कोई दिक्कत नहीं है. That has to be remembered. What is the investigation of choice for achalasia cardia? Esophageal manometry. What is the normal pressure in the lower esophageal sphincter? 8 to 25 millimeters of mercury, beta, definitely. Please remember, but in case of achalasia cardia, the pressure will be more than 25, between 25 to 100 millimeters of mercury. What is the criteria used for diagnosis of achalasia cardia? Chicago criteria. Very good. That's important to be remembered. कोई दिक्कत नहीं है इसमें. That has to be remembered, beta. ठीक है. And if I do a barium swallow, कौन सा appearance दिखेगा? The classical bird beak appearance, also called as the pencil tip sign, beta. नहीं, rat tail नहीं बोल सकते इसको अभी भी. I am firm on that. Bird beak or the pencil tip sign. क्या? अलग ही चल रहा है इनका कुछ. भाई पढ़ने पे ध्यान दे दे. Barium swallow, if I talk about, बेटा, यहाँ पे कौन सा appearance दिखा रहा है ये? Corkscrew appearance, beta, definitely. Also called as rosary bead appearance. ठीक है? Corkscrew or the rosary bead appearance on a barium swallow is a classical picture of TES, that is diffuse esophageal spasm or the distal esophageal spasm. Pressure will be more than 300 millimeters of mercury, but याद रखना, even a pressure of more than 120 millimeters of mercury can be considered as diffuse esophageal spasm. Only thing is, beta, याद रखना, that if the pressure is between 180 to 200, that will be considered as a nutcracker esophagus. Okay, so nutcracker esophagus can be considered as a type of diffuse or a distal esophageal spasm as well. कोई दिक्कत नहीं है इसमें. Treatment यहाँ भी क्या? Investigation of choice यहाँ भी क्या होगा? Esophageal manometry. Treatment यहाँ भी क्या होगा? Myotomy surgery. कोई दिक्कत नहीं है इसमें. Sorry. Just a minute. ठीक है. No issues with this. Anybody? Nissen's fundoplication is the surgery done for, beta. Nissen's fundoplication, when we pull the fundus of the stomach and we wrap it around the esophagus. ठीक है? तो Nissen's fundoplication जो होता है, it is 180 degree wrap or a 360 degree wrap. पूरा 360 degree wrap. It is the surgery of choice in two conditions, beta. Definitely in a patient of GERD. But what is the treatment of choice in a patient of GERD? PPI. तो GERD का पेशेंट अगर तुम्हारे पास आता है, गैस्ट्रोएसोफेजियल रिफ्लक्स डिसीज का, the lower esophageal sphincter relaxes too frequently or does not relax at all? relaxes too frequently, so the pressure will be less or more, less. इंपॉर्टेंट है, इसकी वजह से क्या हो जाता है, एसिड रिफ्लक्स होता रहता है बार बार. इंपॉर्टेंट है इन द केस ऑफ GERD बेटा, if the patient comes to you, what will be your first line management? Very good. Lifestyle modifications. Then you will start, if lifestyle modification fails, proton pump inhibitors. If proton pump inhibitor also fails, then you will go for investigation. And what is the investigation of choice? It is investigation of choice. 24 लेके वो प्रोब लेके घूमेगा क्या? No. So what is better? Upper GI endoscopy. So investigation of choice will be upper GI endoscopy. Gold standard investigation will be 24-hour pH monitoring. pH कितने से कम होना चाहिए? Less than 4. For minimum how many times? 4 times in a total span of 24 hours. शाबाश. और if I say with score beta, important है. D-Mister score more than 14.7 makes a diagnosis of GERD. कोई दिक्कत नहीं है. तो याद रखना हमेशा investigations are not the first line in cases of GERD. ठीक है? No issues with this. Distal esophagectomy यही है. Oringer esophagectomy is distal esophagectomy. ठीक है? Ivor Lewis is the mid esophagectomy. Question number 6 beta. It says a 75-year-old female presents with complaints of fever, generalized weakness and anterior neck swelling since a span of 3 years definitely. But it is rapidly progressing since the past 3 to 4 months. There is also pain over the swelling beta. There's also pain over the swelling. There is hoarseness of voice. She gives history of weight loss, but no history of cancer in the family. What is the most probable diagnosis? Important, definitely. क्या क्या keywords क्या क्या थे तुम्हारे बेटा? सबसे पहले age group of the patient. Definitely 6 to 7 decade of life. ठीक है, 6 to 7 decade of life was the age group. Second important, all thyroid cancers are more common in males or females? Females. Definitely, along with that, there is fever, generalized weakness, anterior neck swelling. 3 years. Next keyword was rapidly progressing. We have a lot of thyroid cancers, beta, but sub rapidly progressing होता है क्या? नहीं, few of them are. And the most rapidly progressing is definitely anaplastic. आगे जाके देखते definitely is the diagnosis suiting. Yes. Next important is क्या है? Pain over the swelling. Thyroid cancers, all the thyroid cancers are painful or painless? Painless. Only one cancer which is rapidly growing and therefore it can easily compress or involve the nerves and that can cause pain is nothing else but anaplastic thyroid cancer. Third important, as it is rapidly growing, it can compress which nerve beta? Recurrent laryngeal nerve. And as it compresses recurrent laryngeal nerve, the patient will have hoarseness of voice. All of these, and weight loss obviously seen in any cancer. All of these are suggestive of which cancer? Anaplastic thyroid cancer beta. Anaplastic thyroid cancer has best prognosis or worst prognosis among all? Worst prognosis among all the thyroid cancers definitely. ठीक है? Is it a differentiated or undifferentiated cancer? Undifferentiated cancer. Okay, if I talk about the thyroid tumors beta, they can be either benign or malignant. What is the most common benign thyroid tumor? Most common benign thyroid tumor is known as follicular adenoma. Most common benign thyroid tumor is known as follicular. So the most common thyroid tumor is nothing but follicular adenoma beta. Malignant tumors can be of two types. If they arise from the thyroid gland itself, then they will be called as primary. But अगर thyroid gland से बाहर से आता है, मतलब there was some other primary cancer which has spread to the thyroid, then that is called as secondary or a metastasis beta. Primary thyroid cancers can arise from three types of cells. तीन cells कौन से होते हैं? In the thyroid follicle, we have the follicular cells. Then outside the thyroid follicle, we have the parafollicular cells. And local defense is given by lymphoid cells. Tumor कहीं से भी हो सकता है. If the tumor is from the follicular cell, either it can be a differentiated or a undifferentiated cancer. Differentiated मतलब बिरयानी या खिचड़ी? बिरयानी। और अनडिफरेंशिएटेड मतलब खिचड़ी। तो ठीक है, तो बिरयानी में जैसे एक एक दाना अलग अलग होता है, दैट इज व्हाट इज अ डिफरेंशिएटेड कैंसर। खिचड़ी में सब कुछ मिक्स होता है, दैट इज अ अनडिफरेंशिएटेड कैंसर। ठीक है, डिफरेंशिएटेड कैंसर्स कैन बी ऑफ थ्री टाइप्स, आइदर फॉलिकुलर थायराइड कैंसर, सेकंड इज papillary thyroid cancer, and third is Hurthal cell cancer. Undifferentiated खिचड़ी को क्या बोलते हो बेटा इन पैथोलॉजी? Lack of differentiation known as anaplasia. So any cancer which shows anaplasia will be called as anaplastic. किसका स्वाद अच्छा होता है? घर जाओ। Important is it is the biryani. That means differentiated thyroid cancers will have a better taste, therefore better prognosis. But on the other hand, khichdi, that is undifferentiated thyroid cancer, will have a bad test, that is a poor or worse prognosis. Parafollicular C cells से जो cancer arise होता है, that is called as medullary thyroid cancer. And lymphoid cells से जो arise होगा, that is thyroid lymphoma. Important is beta, sorry, which among the following is a neuroendocrine tumor? Very good. Neuroendocrine tumor is a medullary thyroid cancer. Why neuroendocrine? Because it produces a hormone-like substance. कौन सा hormone होता है वो? Serotonin. शाबाश. It produces serotonin in excess. That causes serotonin syndrome. इसीलिए a patient of medullary thyroid cancer can have serotonin syndrome के features like flushing and diarrhea. शाबाश. तो अगर thyroid cancers के साथ flushing and diarrhea दिया हो बेटा, that is the direct case of medullary thyroid cancer. कौन से syndrome के साथ associated है वो? कौन सा? Men to A and men to B दोनों के साथ. It is due to which gene mutation बेटा? Red proton को gene mutation on chromosome number 10. शाबाश. Okay. और histopath अगर करेंगे will get a amyloid rich stroma. Normally for all other thyroid cancers बेटा the tumor marker is serum, very good, thyroglobulin. But for a medullary thyroid cancer the tumor marker is serum calcitonin, because parafollicular C cells are known to produce calcitonin बेटा. इस पेशेंट में क्या होगा? हाइपरकैल्सीमिया, हाइपोकैल्सीमिया? हाइपोकैल्सीमिया. क्यों? क्योंकि excess of calcitonin will be produced, that causes hypocalcemia बेटा. Next important, thyroid lymphoma, we know it is more common in the 5th to 7th decade of life. Okay. It is Hodgkin's or non-Hodgkin's? Any lymphoma outside the lymph node is always non-Hodgkin's lymphoma. Most common type of non-Hodgkin's in any other organ? TL, BCL. Please tell me what is the most common extranodal site for a non-Hodgkin's lymphoma? कोई तो बोला शायद. Most common extranodal site for a very good stomach. Most common site extranodal site for a lymphoma is always the stomach. लिखा है ना? That is important. The patients will have category A or B symptom. कौन से disease जैसे? TB like symptoms. Treatment is first line will be chemo, surgery, radio. Chemotherapy. कौन सा regime? R CHOP regime followed by radiotherapy. No issues with this anybody? That has to be remembered. What is the most common thyroid cancer beta? Most common thyroid cancer is papillary thyroid cancer beta. Papillary thyroid cancer will also have the best prognosis. कौन सा gene mutation? BRAF gene mutation beta. Please remember, important is papillary thyroid cancer or follicular thyroid cancer. Both are arising from follicular cells. Both are differentiated and undifferentiated. Both are differentiated. तो दोनों के बीच में दो ही differences है. One is age group of the patient. Second is the risk factor. Young age group में कौन सा common है? Young age group में third to fourth decade of life, papillary thyroid cancer between 20 to 40 years of age. Second, in patients more than 50 years of age, we have follicular thyroid carcinoma. Next important risk factors for papillary thyroid cancer. One is radiation exposure, shabash. Second is a long-standing thyroglossal cyst, shabash. What is the risk factor for follicular thyroid cancer? Just a minute. Very good. It is a multinodular goiter. ये कर लो, उसके बाद ब्रेक ले लो तुम थोड़े टाइम के लिए, इसको ठीक कर. इंपॉर्टेंट इज बेटा इन पैपिलरी थायराइड कैंसर हिस्टोपैथ पे अगर हम देखेंगे तो डेफिनेटली द न्यूक्लियस विच इज देयर इट विल अपीयर एम्प्टी एंड उसको क्या बोलते हैं कौन सा अपीयरेंस ऑर्फन एनियाई न्यूक्लियाई अपीयरेंस एंड व्हिच कैल्सिफाइड बॉडीज आर सीन इन samoma bodies PSM P for all papillary cancers S for serous cyst adenoma M for meningioma second M for mesothelioma shabash that's important ठीक है if I talk about follicular thyroid cancer beta here one investigation cannot be used for diagnosis and that is FNSC for fine needle aspiration cytology is not diagnostic of which thyroid cancer follicular because it cannot differentiate between a follicular adenoma and a follicular तो बेनाइंग और क्या मैलिग्नेंसी के बीच में डिफरेंशिएट नहीं कर सकता इसीलिए एफएनसी कैन नॉट बी यूज्ड फॉर डायग्नोसिस ऑफ फॉलिकुलर थायराइड कैंसर कोई दिक्कत नहीं है उसमें दैट हैज टू बी रिमेंबर्ड ठीक है आ रहा है आ गया okay so orphan anemia nuclear appearance and second is samoma bodies will be seen over here in papillary thyroid cancer on the histopathology कोई दिक्कत नहीं है इसमें what is this beta this patient has a lateral neck swelling and that patient comes to you when a FNSC of this lateral neck swelling was done okay it was seen as enlarged lymph node which was also containing some malignant cells of thyroid what was the diagnosis आने दो उसको अभी आजा भाई what is this diagnosis beta here there is a lateral neck swelling in the patient okay it is an enlarged lymph node jab FNSC kari gayi this enlarged lymph node is actually showing some malignant cells of thyroid but do we have any neck swelling or any thyroid swelling no so what is this very good it is a case of lateral aberrant thyroid aberrant matlab abnormal and lateral aberrant thyroid is nothing but lymph node metastasis from a hidden papillary thyroid cancer jab papillary thyroid cancer hidden hota hai but it directly metastasizes to the lymph node that is called as lateral aberrant thyroid what is this condition when a young child or adolescent comes to you with a midline neck swelling very good it is a case of thyroglossal cyst which moves with deglutation or protrusion of tongue very good important is thyroglossal cyst jo hota hai beta sorry most common site पूछा गया था most common site is very good it is subhyoid or infrahyoid in location very good investigation of choice अगर पूछेंगे बेटा USG neck plus FNAC to rule out any type of cancer or a malignancy very good treatment is with surgery very classical question cyst trunk surgery beta okay this is when a swelling is seen in the middle of the neck beta but if a opening is seen in the middle of neck that is a diagnosis of thyroglossal fistula shabash and thyroglossal fistula jo hota hai is it a congenital or acquired condition always an acquired condition either due to rupture or due to incision and drainage of a thyroglossal cyst beta cyst trunk surgery mein we have to remove the thyroglossal cyst we have to remove the thyroglossal tract agar usko chhod diya to wapas kya ho jayega वापस से cyst बन जाएगा and we also have to remove a part of which bone शाबाश thyroglossal fistula के लिए what is the treatment same cyst trunk surgery itself ठीक है that is important this is neck swelling or chest swelling बेटा नीचे वाला definitely it is a chest swelling behind the sternum so this is which kind of a goiter beta retrosternal goiter retrosternal goiter is nothing but enlargement of thyroid gland जब thyroid gland ज्यादा बड़ी हो जाती है बेटा ठीक है important is what is the most common cause of goiter it is iodine deficiency very good endemic goiter it is but retrosternal goiter can be primary or secondary more common is secondary matlab it starts in the neck but then it grows behind the sternum of the patient beta very good important is retrosternal goiter के लिए ये चचा आएंगे एग्जाम में और ये चचा कौन सी टेस्ट कर रहे हैं Pemberton's test definitely when definitely the patient will be asked to raise both of his hands above the head. जो retrosternal goiter है बेटा वो कहाँ फैलेगा? Neck में. It is going to spread in the neck and compress the neck vessels. As the neck vessels are compressed, all the blood will collect in the face, causing facial congestion or facial plethora. That is known as Pemberton's test. Positive in which kind of goiter? Retrosternal goiter. Investigation of choice बता दो एक बार. Very good. यहाँ पे it is CCT neck plus thorax and this was a PYQ. Please be aware of this fact. ठीक है? ठीक है? Treatment is always any kind of goiter. Treatment has to be always a surgical excision. ठीक है? Retrosternal goiter के लिए commonly we use neck incision or we do a sternotomy बेटा. अभी ठीक है अब देखते हैं. अभी ठीक है देखते हैं. Break दूंगा तो देख लेना. So definitely mostly we use a neck incision because 90% cases are secondary retrosternal goiter which start in the neck. तो बस एक neck incision देंगे. We have to ligate the vessels over here and we have to pull out the goiter बेटा. ठीक है? Sternotomy is done in case of primary or secondary. Primary goiter or in a case of recurrence or in a case of malignancy. शाबाश. ठीक है? Important is ये क्या है बच्चे में? After a dental infection, there is a diffuse chin swelling and trismus along with respiratory distress. Very good. That is the case of Ludwig's angina. There is infection in the floor of mouth. Streptococcus viridans plus anaerobes. Emergency management. Very good. Tracheostomy, because will intubation be possible as the child is not able to open the mouth? Very good. And definitive management, external incision and drainage, क्योंकि पस भरा पड़ा यहाँ पे. ठीक है? Next one, anterolateral neck swelling along the anterior border of sternocleidomastoid. Very good. Bronchial cyst. Bronchial cyst is due to persistence and collection of fluid in which embryological structure? It is due to collection of fluid in the patent cervical sinus बेटा. Cervical sinus patency की वजह से हो सकता है. Important is if anterolateral neck swelling है that is a bronchial cyst. अगर anterolateral side में if there is a opening बेटा that is called as a bronchial fistula. दोनों के लिए treatment will be same, that is a surgical excision. शाबाश. These are all PYQs. ठीक है? Next, ये neonate having a posterolateral neck swelling due to a lymphatic channel defect and collection of lymph in the posterior triangle of neck known as cystic hygroma. जब टॉर्च फ्लैश करेंगे the whole swelling will glow with light. कौन सी टेस्ट है ये? पॉजिटिव और नेगेटिव? चार swellings. First in the posterior triangle of neck known as cystic hygroma. Second in the floor of mouth, ranula. Third in the scrotum, hydrocele. And fourth in the back of a child, meningocele. Very good. Cystic hygroma is a marker of aneuploidy, more commonly Down syndrome. Treatment is surgical excision itself. ठीक है? You cannot keep this cystic hygroma over there. ठीक है? तो याद रखना. और what is this investigation called as excision? What is this investigation called as? Radioactive iodine scan. ठीक है? Radioactive iodine scan में cold nodule and hot nodule है बेटा. तो more chances of malignancy are in cold nodule. Higher risk of malignancy यहाँ पे होती है. Please remember that. ठीक है? 20% risk is there. Important is radioactive iodine scan के लिए we can use it for diagnosis as well as we can also use it for treatment. Diagnosis के लिए it is iodine 123 commonly, others are iodine 125 and iodine 120. But treatment के लिए for thyroid cancer or hyperthyroidism 130. Half life of iodine 123 13 hours and half life of iodine 131 8 days. Radioactive iodine is an example of which kind of relationship? अरे कौन सा relationship था thyroid का ये? अरे जब तुम्हारी जिंदगी में कोई अच्छी कन्या आती है दैट इज अ गुड रिलेशनशिप. ठीक है? थायराइड ऐसी एक प्यार में होता है. किसके प्यार में होता है वो? आयोडीन के. तो उसको जहां भी आयोडीन दिखता है वो उसको उठा लेता है. ठीक है? बट प्रॉब्लम इज बेटा डेफिनेटली कभी कभी क्या होती है? झगड़े नहीं, कभी कभी टॉक्सिक लोग भी आते हैं तुम्हारी जिंदगी में एंड ऐसा ही टॉक्सिक आयोडीन जो होता है उसकी जिंदगी में दैट इज रेडियो एक्टिव आयोडीन. ये जैसे ही थायराइड के अंदर जाएगा ये क्या करेगा? एमिट रेडिएशन. इट विल एमिट अ लॉट ऑफ टॉक्सिसिटी एंड उसकी पूरी जिंदगी बर्बाद. तो वही करता है रेडियो एक्टिव आयोडीन इज गोइंग टू डिस्ट्रॉय द होल थायराइड follicle. That is what is done. Which rays are emitted? बीटा रे, शाबाश, ठीक है। वांट अ ब्रेक? टिल दैट टाइम आई विल फिगर इट आउट क्या है। 40 minutes? हाँ, 40 minutes